is Jocelyn. Is it okay if I record your respiratory assessment for class?
Mm-hmm.
Perfect. I'm gonna wash my hands with soap and water. Can you tell me your first and last name, please?
Miguel Esparra,
Okay, when's your birthday?
July 5th, 1996.
Perfect. So I'm gonna start off by asking you a few questions. Do you have a history of any lung cancer?
Oh, ma'am.
Okay. Do you have any history of any respiratory problems like asthma, emphysema, or bronchitis?
I had asthma when I was a kid, but don't really have it anymore.
Okay. And do you smoke?
No, ma'am.
Have you ever smoked in your life?
No.
Good. So I'm going to first start off also by inspecting your chest. Your chest is looking symmetric. Your respirations are within normal limits, around 16 breaths per minute, which is good. You have a great rhythm, a normal rhythm, and your respirations are deep. There's no retractions. Your posture is nice and straight. You're not leaning forward to try to breathe. And your skin color is appropriate for your ethnicity. There's no discoloration of your skin or a bluish tint to you that could indicate a lack of oxygenation to your body. If I inspect your anterior chest, I'm going to inspect your posterior here. You have about a 1 to 2 anterior posterior ratio that you have. Okay, and then the next thing that I'm going to do is I'm going to palpate your chest. You let me know if anything hurts, if you're tender anywhere. Perfect. And then if you want to lift your arms up a little bit, perfect. All right, and if you can kind of turn to the side for me, I'm going to palpate the back, kind of following your scapula here. Any tenderness anywhere?
No, ma'am.
Okay, good. And also your posterior is looking good, within normal limits, skin color, which is good. If you can stand up for me, please. And if you turn around, I'm going to check your chest expansion, just like this. Thank you, perfect. All right, take a deep breath. Good, do it again. Perfect. All righty, it's proper expansion there. If you can take a seat for me again. I'm going to go ahead and auscultate. I'm going to listen to your trachea first. I'm going to step to this side. I'm going to do this side first. Take a deep breath. And just keep taking a few deep breaths. Good. And if you can lift your arms again, just like we did earlier. Gonna listen here. Beautiful. Alrighty, and if we can stand and then turn around again. Listen to your back. Perfect. Perfect. Alrighty, you can take a seat for me again. So above your trachea, I heard some vesicular sounds, bronchial sounds, I'm sorry, which is what we want to hear. And then towards the center of your chest, your sternum area, we heard bronchovesicular sounds. And then towards the bottom, we heard vesicular sounds, which is what we want to hear on both sides, which is good. Another thing to know is that when I did your palpation as well, that there was no masses. I did not feel anything bulging in any area there, so that's good. The last thing that I'm going to do is I'm going to percuss your chest and your back, okay? So you want to feel resonance, hear resonance, and then towards the bottom you feel more of a dullness. You hear, and if you can do this side and this side, and we're going to do the same thing in the back. Perfect. Alrighty, we're done. Thank you for letting me do my assessment on you.